Hello, everyone. My name is Dr. Chidi Numeriker Emeka. I'm the president and the CEO of Hope for the Needy and Evangelical Foundation, Incorporated. Hope for the Needy is a charity, nonprofit organization based in Maryland, United States. I'm licensed to practice here in the United States. My specialty is foot and ankle. This presentation is in line with what we do as an organization, which is to help people. Our website is Hope for the Needy and Evang.com. You can see it on the screen. You guys can check it out. We will be talking about plantar fasciitis. In a layman's language, is called heel pain. So, what is this plantar fasciitis? Plantar fasciitis can be defined as an overuse injury to the plantar fascia and the peripheral structures, which causes micro tears and inflammation to the involved tissues over time, or simply an inflammation of the plantar fascia secondary to excessive tension and overuse. In the absence of inflammation, plantar fasciitis is best described as a plantar fasciosis, which is nothing but a degenerative condition. The plantar fascia is composed of three bands, which are the lateral, the central, and the medial band. The central band, which is the thickest and the strongest, divides into 5 slips, and each slip divides into a superficial and deep tract. The plantar fascia originates from the medial tubercle and plantar surface of the calcaneus and inserts in the flexor sheath, volar plate of the base of proximal phalanx of digits 1 to 5, and the skin. Heel lift with ankle plantar flexion and metatarsal phalangeal joint dorsiflexion tightens the plantar fascia, raises the arch and shortens the foot, and assists in the resupinating the subtalar joint during the propulsive phase of gait cycle, a mechanism known as Windler's mechanism. The Windler's test: extension of all the metatarsophalangeal joints significantly increases strain in the plantar fascia and also in the tibial nerve, and LPM and MPN. LPN is lateral plantar nerve and MPN is medial plantar nerve. The average range of motion at the first metatarsal phalangeal joint at this period is 55 to 85 degrees, which is as a result of heel extension, knee flexion, and ankle plantar flexion. Plantar fasciitis needs to be differentiated from the non-mechanical inflammatory pathologies such as rheumatoid arthritis, gout or residual gout, ankylosing spondylitis, psoriatic arthritis, neuropathy of the first branch of the lateral plantar nerve, calcaneal stress fracture, tunnel syndrome, Mayer-Strom-Pell disease, Paget disease, Reuters syndrome, Behcet syndrome, arterial insufficiency, SLE, inflammatory bowel syndrome, and unicameral bone cysts. Others are plantar heel pain syndrome, heel bursitis, heel spur syndrome, subcalcaneal pain, and chronic plantar heel pain. Plantar fasciitis uniquely presents with a pain which is felt most times at the plantar arch along the course of the plantar fascia. The heel pain is most severe on arising in the morning, and this is known as post-static dyskinesia. The symptoms tend to increase as more time is spent on weight bearing. Local tenderness in the area of the central band, medial calcaneal tubercle, and other areas of the fascia are frequent findings with post-static dyskinesia. So now, what are the causes of this plantar fasciitis? There are many and they vary from person to person. Significant amongst the causative factors are overuse and increased stress on soft tissues and joints on the plantar aspect of the foot, which is directly related to increased weight and stress on the plantar fascia, commonly found but not limited to obese individuals. Other common causes are increased athletic activity, flat foot, which is poor planus, poor cavils, which is high arch foot, rigid, rigid foot, poor supporting shoes, this very high pointed heel shoes. Another one is large weight gain, like in pregnancy and normal aging. A study indicates that an increase in hamstring tightness may induce prolonged forefoot loading and through the windlass mechanism be a factor that increases repetitive injury to plantar fascia. A study also correlated positively pain to fascial thickness and arch angle. That's when the pain fascial is thick and large arch angle. What are the treatments for this plantar fasciitis? There are many treatment modalities available, which is divided into conservatives, the non-invasive treatment of plantar fasciitis, intermediate, which is also non-invasive or a little bit invasive, then surgical treatments, which is highly invasive treatment. And we are going to stop here so far. So our next video will gear towards dissecting or explaining in details some conservative treatments of this heel pain, one by one. We're going to explain them one by one. That is the things you can do at home to help you with heel pain. Here we are going to draw the curtains. Thanks for watching. If you enjoyed and like this video, please give it a thumbs up, like it, share it, subscribe to this channel. Also push the alert button so you can be notified anytime we put out videos like this. I would like to ask that we need your big hand to change our world, and please do donate if you can to change someone's life. Thank you. See you on my next video.